So today I'm going to show how I would treat a patient that presents in the clinic with a posterior lateral mechanical derangement. What does that all mean? That actually means this patient has low back pain and going into her right leg. It may be above the knee, it may be below the knee. But the first and most important component is to find the starting point. So what do I mean by that? When I evaluated the patient, I found out that she had some pain with flexion, sitting, bending, twisting, lifting, and when we would put her in a position of prone lying, which means on her belly, we were able to determine she had the least amount of pain, if any, down the leg. So the starting point for me, for her, was to be up on one pillow, so she's got a little bit of bent structure here, and we're going to try to centralize her pain. So the first and foremost treatment component is to get the pain out of the leg to perform the exercises correctly. McKenzie has this reputation of having a ton of extension exercises, but that's probably because the most common form of treatment for a posterior lateral derangement, which is the most common thing we see in the clinic, is to perform some type of extension. But like I said, you got to find the starting point. So for her starting point, up on one pillow, she had to move her leg off to the side to a certain degree where she felt the most comfortable. And this is where every patient is different. Some patients might need more flexion, less flexion, maybe just a little lift, but that's kind of where she tells me how she has the least amount of pain in her leg. And from that point on, we would perform extension exercises in a very gradual pattern. She would lay here for a few minutes. After a few minutes, she would tell me there's no leg pain. Then we would actually remove a pillow. So I'd have her lift up and we'd remove a pillow, throw that down to the floor. She would then find her starting point again, put the position of the leg where it feels the most comfortable. She would put the leg up higher wherever she feels the most comfortable. She's directing all the treatment. And then we lay there for a few minutes. Once that gets better, she would then go up into the next progression, up on her elbows. Stay there for a couple minutes, move her leg wherever she needs to move it so that she feels the most comfortable. And then once she's pain-free in that position, we would then perform press-ups, which are the most common exercise that McKenzie is known for, even though it's not just press-ups. She would bring her leg down, do her press-ups that I've already taught her, and then back down. If she had pain in this position, she would also move that leg off to the side to make it pain-free. That's good. So that's kind of how a quick version of the McKenzie method would work. But again, I would make sure you were evaluated by a trained physical therapist to teach you how it works with the centralization process and to find that starting point. Because if you're working through pain, you're not doing the exercises correctly.